Now we will start discussing key point number 3, which deals with digestive problems. In key point number 1, we talked about the digestive system as a whole. In key point number 2, we discussed some of the details of the absorption and utilization of nutrients. Now let's talk about when things don't quite go as planned in the digestive system. Some of the bullet points that we'll talk about are choking, vomiting, diarrhea, and constipation. You'll notice those all come under one heading because they have very similar treatments and sometimes similar causes. Diverticulosis/litis. Diverticulitis is the inflammation phase of a certain condition. We'll talk about more details in a moment. Gas, heartburn/GERD, which stands for gastroesophageal reflux disease. This is when the contents of the stomach refluxes back into the esophagus. Irritable bowel syndrome, sometimes called IBS, and peptic ulcer disease. First, when we talk about choking, it's good to remember that when someone is truly having a problem with choking, they will not be able to make a sound. So the best thing to do when you see somebody coughing or struggling while they're eating, and you think or anticipate it may be that they're choking, ask them, can you make a sound? If they can make a sound or they can cough, sometimes it's best to just stand by but not intervene and let them try to resolve it on their own. If they're not making a sound, that's when you want to act quickly, and you want to choose someone to call 911 before you might intervene and try the Heimlich maneuver. The way you want to do that is you want to pick someone out of the crowd and get eye contact with them and point at them and say, you call 911. Make sure that they communicate back with their eyes, that they understand, and that you see them heading to do that. That's the best and most effective way versus calling out to the whole crowd, someone call 911. And then if you've been trained and you feel comfortable on the Heimlich maneuver, you would then want to try that. The book goes over those techniques, and I encourage anybody, it's just a great skill to have up your sleeve because when you need it instantly to be effective. This is also a good reminder as to why we don't want to leave small children in the room alone while they're eating, because we will not hear anything when they start struggling with choking. So we want to make sure that we're somewhere within viewpoint that we can tell if they might be having problems. Next up, we'll talk about vomiting. Vomiting is truly actually reverse peristalsis, and sometimes it feels more like it's our gut kind of convulsing out, but it truly is reverse peristalsis happening along the GI tract. What we need to do as treatment is replace fluids as quickly as we can. And the best fluids, of course, would be things that have electrolyte replacements in them, such as Pedialyte if it's for children, or even for adults, or a light Gatorade. These are the best choices, but in an ideal world, we get people to drink those. If you have small children yourself, you might know that they don't always take what you would love them to have in the ideal world. So then we go to the next options down, which we would consider juices, 7-Up, ginger ale, or some sort of salty broth. No matter what the fluid that you choose, what you want to think about, though, is teaspoonful at a time. I know that in the midst of vomiting that sometimes it seems counterproductive to be putting anything in because you feel it's going to come right back up and aggravate the situation more. But truthfully, it does help because it only takes about 10 minutes for fluid to be absorbed in the gut. So if you're able to withhold from vomiting for at least 10 minutes, then you are absorbing some fluid. If the vomiting persists, then you would want to contact a physician, particularly if you're dealing with a small child or an elderly person. The biggest concern would be the fluid and electrolyte balances that might take place, as well as dehydration. Likewise with diarrhea, the concern would be to replace fluids quickly and steadily to make sure that that person doesn't get dehydrated. And the opposite is happening with diarrhea, where you have peristalsis, but it's a speedy peristalsis, where the stool leaves the body before the water can be reabsorbed in the large intestine. There's many, many causes for diarrhea, too many to really discuss in this level of a class, but appreciate the fact that it can be a complex topic, and really the best thing from our perspective is just to keep in mind that fluid replacement is the key treatment, and then to contact a physician if it persists for more than 24 hours and you think that the person suffering from it is dehydrating. Constipation is often a misunderstood condition and not properly defined. What you really want to do is ask a person what is their normal schedule for bowel movements. For some people it may be 3 times a day, and for some people it may be every other day. It's when that normal routine changes that we define it as constipation, when it goes for longer than their usual. What's typically happening in that situation is too much water is removed from the feces, therefore the bowel movement gets harder and drier and more difficult to pass. Many causes for this can be so, but the main ones that we look at are immobility, particularly after some sort of orthopedic surgery where someone can't move around. In addition to that, many times they're taking a medication, pain medication, that the nature of how those medications work, they also slow down the peristalsis of the GI tract, which would then result in less bowel movements. In addition, pregnancy can cause constipation. This is mostly a mechanical problem where there's a lot of weight sitting on the large intestine, which can interfere with the normal movement of the colon. How do we prevent constipation or treat it? Most people already know that they would look at the fiber content of their diet and increase fiber, but many times they miss the point that they also need to increase fluid. So make sure that you're thinking about the fluid content as well. Diverticulosis and litis. What this is we have a nice strong muscle in the large intestine, and as we get older the tone of our whole body can change, but our large intestine as well can get these small divots or pockets in them when it's not kept in good health, and we call this diverticulosis. Sometimes some hardened feces might get stuck in those pockets and irritate that area and cause inflammation, and that is what diverticulitis is. It can be very painful. Sometimes it can get to the extent where it actually does what we call perforates, where it breaks through the large intestine wall and goes out into the peritoneum area. How do we treat diverticulosis? Well, if they're in the inflammation phase, we treat with low fiber, low residue, where you might see someone on a clear liquid diet just to rest the bowel and reduce the amount of irritation in that area. After that time, when they've all healed up from the inflammation, then they would try to go back to a high fiber, lots of fluids in the diet. Gas is something that all of us have dealt with at some point in our life. Belching would be one form of gas problems, typically caused by swallowing extra air or ill-fitting dentures. We've all, of course, experimented with carbonated beverages and how that can increase the amount of belching that we might do. Next up, though, would be intestinal gas, and sometimes we can intervene on that and just relax a little more while eating and improve the amount of intestinal gas that we produce. But many times it's a reaction to individual foods, and for each person it can be different and a slightly different etiology to it. Something like milk. There's quite a few people who are short on the lactase enzyme, which is the enzyme that breaks down lactose, the milk sugar. When that happens, the milk continues through the small intestine undigested. So then you have this whole sugar ending up in the large intestine that normally doesn't belong there. And you have a bacteria, which is a normal flora of bacteria in the large intestine, that will use that lactose sugar as fuel. And when that bacteria starts to use it as fuel, the byproduct is fatty acids and gas as bacteria metabolize it for fuel. And that causes the cramping and gas in the individual. Heartburn or gastroesophageal reflux disease is when the acidic contents of the stomach fluxes back or re-enters into the esophagus. We talked about in a couple of the previous lectures that we have a sphincter valve called the cardiac sphincter, which is at the top of the stomach. And the function of that is partly to just hold the contents of the stomach in. And when we sit down, lay down, or have lots of pressure in the stomach, sometimes that causes that valve to flip back open when we don't want it to. And so that acid contents of the stomach flows back into the esophagus, which can be painful because the esophagus does not have that nice mucus protection lining like the stomach. Who's at increased risk for this condition is anyone who's pregnant or obese, and this again would be a mechanical problem where you've got extra pressure in the abdomen area pressing against the stomach and again doing back pressure on that cardiac sphincter valve, which causes it to open back up. Smokers also tend to have more difficulty with this, and certain medications can precipitate this problem. How do we prevent it? Well, there's certain strategies that can help. Having small, frequent, low-fat meals is one way to reduce the amount of pressure that at any one given time is in the stomach. Not laying down right after a meal. Avoiding gastric irritants, and in the hospital setting sometimes we call this a CAP-free diet, C-A-P, standing for caffeine, alcohol, and peppers. Avoiding tight-fitting jeans of all things, again, because that does cause back pressure on the stomach. Or weight loss. Another strategy sometimes is to avoid drinking liquids during the meal, saving those for an hour prior or an hour after the meal instead. And what that does is, again, just reduces the volume in the stomach at any given time, which therefore would reduce the back pressure. Another condition called irritable bowel syndrome tends to be more of a catch-all condition when doctors are having a difficult time figuring out exactly what's going on with the GI tract. The condition symptoms usually go kind of sporadic, where they might have diarrhea for a few days or a week and then it flips back to constipation. The best therapy or approach to this typically is keeping food diaries and tracking symptoms and trying to do a little strategic work on looking at what patterns there are in symptoms as compared to what someone's eating, and see if the medical practitioner can sort some of that out. Peptic ulcer disease is when there is erosion of the stomach lining, or it can also be the duodenum, which is the top portion of the small intestine. And again, what happens is there's exposure of the underlying cells of the stomach, so that mucus barrier breaks down for whatever reason, and the acid touches those cells, which causes pain. If it continues to occur, then it can erode all the way down to the capillary level, which is what we would call a bleeding ulcer. What are some causes they feel? Well, we know that smoking and aspirin can decrease mucus production and compromise that mucus layer in the stomach. In addition, though, there's more research going on looking at the bacteria H. pylori and its role in causing peptic ulcer disease. Treatment truly leads back to prescribed medicines as far as being very effective when someone is having a real problem with peptic ulcers. Although, kind of as a palliative treatment, we would also encourage someone to avoid caffeine or alcoholic beverages because those are irritants to the stomach. Stop smoking to hopefully increase that mucus production, and also do a little stress management.